At Workday, we have proven healthcare planning methodologies to allow healthcare organizations to remain agile and adjust to changing conditions. Our point of view is that we budget by exception and allow the hospital drivers to drive the plan and the forecast. These high-level assumptions at the entity level drive the volumes at the departmental level. As a best practice, we would use the same drivers to calculate net patient service revenue and labor and non-labor expenses to get to the budgeted net income. This means that the volume drivers for expenses and patient service revenue always remain in sync. These driver-based methodologies allow us to create what-if scenarios quickly and on the fly, and then we can compare those scenarios side by side. Now, let's take a look on how we can set these financial statement drivers in Workday Adaptive Planning. Notice across the top, I'm in my assumption section for my financial statement drivers. I have driver accounts in the rows. I have my working budget time in the columns. If I wanted to change how this looked, I have display options. So if I wanted to look at last year so I could compare it side by side to my budget, or if I want to look at my forecast for next year, I can do that. And look at the types of things that I am budgeting for. I have some inflationary increases. I have my hospital level drivers, admissions, patient days, ED visits. I have my net revenue spread, surgery cases, etc. Let's focus on total patient days in row 8. Notice the spread is not even. That is based on prior year seasonality. Notice in December for patient days, I have this little tick mark. Well, that means that I have a note in the cell. Well, notes are well and good, but what's really powerful in Workday Adaptive Planning is that audit is always on. So whether you're in an assumption sheet, a budget sheet, a report, or a dashboard, audit is always on and you can always see the audit trail. So notice here, I can see that my patient days were changed from 3,866 to 4,000, when they were changed, who changed them, and all the notes that attach to this cell. What do you have to do today if you want to do a what-if analysis? What if my patient days increased? Well, let me show you how easy it is in Workday Adaptive Planning. I'm going to change my version from the working budget to the working budget add patient days. I'm going to change patient days to 50,000 in my new version. It asks me how I want to spread this back. I'm going to choose proportionately because that's based on seasonality. Now that I've made those changes, because everything happens in real time, anything that leverages patient days, whether it's the hospital level or at the departmental level, will be adjusted in real time. Now we have to allocate the total patient days down to the different nursing departments. I can see that 100% of my patient days have been allocated out. I can see the 50,000. If I want to see how they got allocated to all the different departments, I can see the percentages. And I can also see the days that were allocated. Because this happens in real time, when I am the nurse manager for Nursing 3 East here on row 2, the patient days that will be in my department are 7,628. I can now compare the working budget add patient days to the working budget and see the full financial impact of making that change to the patient days.